Hey, this is Dr. Sean with The Active Life, here to give you a brute tip of the day. We're going to be talking to you today about minimizing your back pain when you're squatting and deadlifting. We get a lot of patients who come to us and tell us, when I squat or when I deadlift, I get back pain. They tell us especially I get back pain when I'm squatting heavy, or especially when I do a lot of reps, or when I deadlift heavy, or when I deadlift for a lot of reps. So we're going to go over some of the quick and easy things that you can do to minimize the risk and the pain that you experience with those two exercises. Our first tip is a little bit of a strength ratio situation. We want to make sure that your back squat is right about 80% of your deadlift. If your back squat is much higher than 80% of your deadlift or much lower than 80% of your deadlift, you're going to compensate when you lift and switch and try to use the other muscles that are more dominant during the lift that you're better at. So of course there's some variation that's acceptable, but 80% is the goal. Whether that's your 1 rep, your 10 rep, or your 20 rep, we want your back squat to be about 80% of your deadlift. The second tip is that we want you to be able to take 50% of your 1 rep max back squat or your 1 rep max deadlift and do 20 reps of it. Slower down, faster up, in under 1 minute and 30 seconds. When you're done with those 20 reps, we want you to go ahead and take your respiratory rate. It should be less than 5 breaths in the first 20 seconds after the bout is complete. That lets us know that you won't be in respiratory distress during heavy and long sets, and that you'll be able to keep your midline stability as good as possible. The third tip, we want to see how well you perform left leg versus right leg. So, are you able to step up with a barbell in the front rack or the back rack as well on your left leg as you are on your right leg? We're going to use a box that's higher than your knee height. We want to emulate the depth that you're squatting to, so that's got to be knee above hip crease. And we're going to do as many reps as we can on the left, followed by as many reps as we can on the right. Try to choose a weight that you fail on the weaker leg, somewhere between 6 and 10 reps. Anything between 85 and 100% of the amount of reps completed on the left versus the right is acceptable. But if we're looking at rep schemes below 80%, it means that when you start to squat, you're going to favor one leg over the other, and that's going to lead to that helicopter hip and the low back pain that we're talking about. The fourth tip that we like to go over is we want to determine your bottom squat rather than have you just squat to an arbitrary bottom dictated by the CrossFit Games. So the way we're going to do that is we're going to have you lie on your back, and we're going to measure the amount of hip flexion that you're able to go through before your back starts to round. The likelihood is that one leg will be a little bit better than the other, and we're going to err on the side of caution and tell you that the bottom of your squat is going to be the depth that the worst performing leg can achieve. We'll go over some tips on how to make that better as we go forward on these videos. Today, we just want to help you guys figure out the bottom of your squat. Okay, so for supine hip flexion, what we're looking to do is see the range of motion that Jeremy has in his hips before it starts to go through his lower back. It might be a little bit difficult for you guys to see on camera, but we're going to try it here, and then we're going to stand him up and we're going to show you what we're talking about. We're going to go ahead and take our partner's leg, I'm going to bend it. I'm going to throw my hand underneath his back. Right, so it fits underneath his back. He's just nice and relaxed. Now all we're gonna do is bring this knee to his chest until his back starts to round into my hand. I feel the pressure. I know that's the end. We're gonna start again and say, okay, let's try that again. And right about there, Jeremy's back starts to round into my hand. So I would take my hand out and tell Jeremy, that's as deep as I want you to back squat, right? Because we know at this point his back is starting to round and he's putting it at risk for injury. So a really bad example of that would be if Jeremy, his back, don't exaggerate too much, if I bring his knee up towards his chest and then right about there it starts to round, right? We say, okay, maybe that was a fluke, let's bring it back down, let's try it again. Bring his knee to his chest and boom, it starts to round again. What we're seeing here is that before Jeremy even reaches parallel, his low back is at risk. So the person who does this and then continues to squat to depth and to depth and to depth because that's what CrossFit told them to do or because their coach told them to do, that person is at risk of being in back pain. And that's the kind of person that we want to work with, or that you should be going to see a doctor local to you to increase that hip range of motion before squatting all the way to depth. Jeremy squats down. We're going to show you what a good neutral back posture looks like. So go ahead and squat, Jeremy. You see the nice flat line in his back as he reaches the bottom, and it doesn't change all the way down. And you come on back up. Let's do it again, nice and flat. Keep it nice and good for us, Jeremy. Comes down, the back is nice and flat. Now Jeremy's going to come on up and exaggerate for you and show you what would happen at the same point that the back starts to round into the floor. You start to see this. This starts to push out into you. It's a little bit different than the butt wink that you might have heard of before, but we're not going to get into that too much today. It's a big rounding down here. This spine is at risk of injury. We want to avoid that. In summary, if you're getting pain with your back squat or your deadlift, or you want to avoid getting pain with your back squat or your deadlift, we recommend a few things. Make sure that the ratio of your 1 rep max and your 20 rep max back squat is 80% of your 1 rep max and 20 rep max deadlift or thereabout. Number 2, make sure that your left leg force production is relatively in line with your right leg force production. Number 3, make sure that your respiratory rate is not out of control after performing a long bout of 50% of your 1 rep max for 20 with a slower eccentric and a faster concentric. And number 4, make sure that you're hitting your bottom and not some arbitrary bottom. We're going to test that with that supine hip flexion. Until next time, let's get moving.